Good afternoon, everyone. We're coming to you from our community room in Long Beach Unified School District District Office. I'm Jill Baker, Superintendent of Schools, and I'm glad to be here with Mr. Christensen, who's going to co-moderate our panel this afternoon. We're here to provide some information in response to the many questions that have come out from staff. And today's presentation is specifically focused for staff, although we know that others may be watching as well. We've taken questions that you submitted and tried to take the most frequently asked questions for our esteemed panelists today, most of whom you will recognize in a moment. And so they're each going to share some things from their area of expertise, and then Mr. Itzen and I will moderate some question and answers that have been submitted on the social media account. So we're glad you're here this afternoon. This is the first of a sequence of informational sessions and Q&As that we'll hold this month in response to both parents and staff who have questions, and we want to answer the questions that you have in the best way possible. So let's go ahead. I'm going to have the panelists introduce themselves.
Good afternoon, everyone. My name is Jose Delamora. I'm the Director of Operations.
Good afternoon, Tiffany Brown, Deputy Superintendent.
Good afternoon, David Zaid, Assistant Superintendent.
And hello, Erin Simon, Assistant Superintendent of School Support Services.
So each of our panelists today is going to start with a bit of information. Some of it may feel like repeat for you because this week we have attempted to use our social media and our media accounts and direct messaging to our community and to staff around health and safety. So today's panel presentation and questions should reinforce much of what has been shared already, but also incorporate some of the new questions that you have submitted. So I'll call upon Jose to give a little informational update, and then we'll begin the questions.
I wanted to begin today explaining the differences between cleaning, sanitizing, and disinfecting. Cleaning is a physical process of removing dirt, germs, viruses, and bacteria, typically using a soap and water solution. Now, one question has been raised as to the effectiveness of Huggies wipes. Yes, you can use Huggies wipes to clean a surface. Not a problem. We provided Huggies wipes right around March or so for the classrooms. These were used to address personal workspaces and keyboards. And to answer that question that has come up a couple of times, yes, the Huggies wipes are effective against or for cleaning a surface. Sanitizing is removing and lowering the number of germs to a safe level as judged by public health standards. You can use a disinfectant to sanitize a surface. And what I mean by that is that you can let that disinfectant sit on that surface for 30 seconds, wipe it clean. Now that surface will be sanitized. Disinfecting a surface it's using chemicals to kill the germs. So if you use a disinfectant, the current disinfectant that we're using here in our district has a 10-minute dwell time, meaning that it needs to sit in contact with that surface for 10 minutes in order for that surface to be disinfected. So I just wanted to make sure that I gave you a little explanation on what the processes were for cleaning, sanitizing, and disinfecting. The operations branch has purchased 250 electrostatic sprayers for each night custodian to be able to disinfect horizontal and flat surfaces on their assignments. Our custodians are currently receiving training as of this week, actually, and we hope to have this training wrapped up by next week. That way, all of our custodial staff members at every single site will be ready to implement the new tools and equipment that have been provided to them so they can effectively disinfect your spaces. I wanted to give you a little more information. In the past, prior to COVID, the only spaces that were being disinfected on a daily basis were restrooms. All other areas were being cleaned or sanitized. Now the difference is, moving forward, all horizontal and flat or horizontal and high-touch surfaces will be cleaned or disinfected on a nightly basis using the electrostatic cleaner or sprayers. I wanted to get into Restrooms also, I believe a couple of questions have come up as far as how we're going to be addressing restrooms. Restrooms will be policed 3 times a day, making sure that all soap and paper towel dispensers are replenished on a daily basis, or not just daily, but during the inspections. Any spills will be mopped up, and high-touch areas will be sanitized also. This will be done again 3 times per day, and the disinfection process will be done once a day. This is going to be conducted by the evening custodial staff before the end of their shift. So we will be addressing restrooms 3 times a day, being policed and disinfecting right at the end by the custodial teams at each individual site. We are currently exploring, as I previously mentioned in our video, we are currently exploring the use of nanotechnology. We've received first rounds of testing. This is through an individual lab, and I wanted to share with you that the results are very promising. So I wanted to keep you in tune as far as that goes. And we're also, as I mentioned, we're also exploring the use of new disinfectants. And again, we're always exploring ways to keep our staff, students, and all stakeholders safe.
Thank you, Jose. We're on to Dr. Brown.
Good afternoon. I wanted to share a little bit more information regarding the personal protective equipment that we've purchased and that we will be using. Following the video from earlier in the week, there were a number of questions that came in regarding the protocols that we will be working with and creating to share with staff as schools and staff are back on campus. So I think it's important to note that in each of the areas of personal protective equipment, or PPE, that includes mask use, gloves, gowns, face shields, we have protocols that have been created in recommendation with the Long Beach Health Department and the LA County Department of Health, and we will be sharing those protocols with principals beginning next week so that they have full information about the expectations, the requirements, the recommendations that will be in place as our staff returns to campus and ultimately as our students return to campus. One of the questions that often comes up and came up even this week is, what if somebody is refusing to wear a mask? And right now and always going forward, we are working from orders from the health department. So right now, mask use is required if you are in a close space, which is defined as a 6-foot distance for 15 minutes or more. So at this point, if a contact meets that parameter, a mask is required. It's not a choice, it's something that's required. It will be required for staff, it will be required for students upon their return, and it will be required for anyone coming onto the campus, as long as there is no change in the order upon students' return. So one of the things that we've learned through this process is that information can change very quickly. Something that is a recommendation and an order today can be different tomorrow. Sometimes we've experienced it to be different later today. And so we are always working from the most current guidance and working with the requirements that are given per that guidance. On the moment that students return to our campus, we will be working from the most current guidance that we have. And in the event that masks are still required at that time, then students will be required to wear masks. There has been a provision that's been made for students who are second grade and below, recognizing that it could be very challenging for young children to wear masks. And so we will be working with that guidance as the time when students are coming onto our campus draws near. Something that's also come up is the questions about the use of face shields. So a face shield is a clear protectant that is worn at the forehead and over the face. And one of the questions that came up this week is, if I'm wearing a face shield, do I also need to wear a mask? And the answer to that is yes, a facial covering is also needed if you meet that definition of close contact. So less than 6 feet for more than 15 minutes. And a face shield is not enough. A facial covering would also need to be worn. However, if you're not in close contact, then it is just fine to wear only a face shield. So thinking about a teacher in front of a classroom, if the distance between the teacher and the students were more than 6 feet, it would be fine to purely wear a face shield. In the moment that the teacher is moving throughout the classroom and having more contact or close contact with students, a facial covering would also need to be worn. So again, we are working with the current information that we have, and we will continue to work with that. Another question to just quickly address it that has come up is, what if a student refuses to wear a facial covering? That's something that I know has come up and is in the minds of many teachers. And one of the things that we know about our teachers is that they are very skilled in working with different types of challenging behaviors. And so we want to first treat the issue of refusal to wear a mask as an act of discomfort, that maybe the student is not choosing to not wear the facial covering because they're being defiant, but rather because they're uncomfortable. And so what we would ask is that the student is approached in a warm way to ask what the struggle is that they're having. Do they need a break? Do they need to take a walk? Do they need to get some air? The expectation when masks are required is that a student will wear them. And if we move into a space where a student is truly not able to maintain wearing a facial covering, then the conversation that we would need to engage in would be one that works in tandem with the parent around the instructional options that we're offering. A question that would likely be asked is, if a student is not able to or refuses to tolerate wearing a facial covering, then should they be considering one of the other instructional options that are available at this time? And we would move towards that conversation before we would want to walk down a road of discipline for something like not being able to or refusing to wear a mask.
Thank you, Dr. Brown. Next, we'll hear from Mr. Zaid.
Good afternoon, everyone. I am going to be sharing some of the common area protocols that were developed and that we currently have in place at all of our administration buildings and all of our sites. And so our common area protocols were developed in collaboration with each one of our leaders representing all of our sites. And a part of this was not only to comply with guidelines that we were receiving and new updates to those guidelines, but it also served as a communication tool. And so the common area protocols cover a couple of key areas. That first area includes common area cleaning procedures. And so it talks about how break rooms and bathrooms and common areas and hallways and high-touch areas will be cleaned and sanitized. The next portion talks about personal measures that are taken. And in those personal measures, it lists hand sanitizer that is available, making sure that all employees are given access and permitted to wash their hands at least every 30 minutes. So giving those opportunities. And then the next section goes into employees, contracted workers, anyone who is on duty who is in a common area, the requirement to make sure that they are wearing a face covering. And that includes hallways, stairways, parking structures, and those common spaces. Next, the protocol identifies the common rooms, which always have social distancing in place. Common rooms that might be for lunch consumption or other interactions. It outlines meeting rooms and it outlines traffic areas. From the common area protocols, we also have several posters that were created as reminders. And so some of those posters include poster reminders to wear a face mask, directional walkways and directional staircases that allow you to see which side is up versus down to continue to keep that distance in place. It also includes having maximum capacity signage in rooms, so we know the maximum amount of capacity, as well as elevator etiquette. So when there is an elevator present, how many individuals can be on the elevator at one time and maintain social distancing. So having that posted right there in front of each elevator is one of the ways that we not only comply, but also communicate with all of our employees and help each individual interacting or working on our campus understand what the shared expectation is and what the communication is. So we not only have a tangible protocol that can be read, that can be accessed, that can be reviewed by all employees, but it's also codified in posters where you have an opportunity to have those consistent reminders as you enter, exit, and interact inside of our buildings. And these are just some of the ways that we are making sure that health and safety is of our employees and for each individual is at the forefront of what we do. While I have the camera time, I'll go ahead and take a moment to answer some of the questions that we receive as well. We get quite a few questions that come in, and I recognize that I have some substitutes that might be out there who are sending in questions and also saying, I know that you guys are taking care of your teachers and your current employees, but we have some questions as well. And so we know that we've gotten several calls in our human resource office. And so I just want to share with all of our substitutes. First, I want to say thank you for filling out the survey that talks about your availability. So I appreciate each and every one of you who has already filled that out. And then I just want to answer that burning question of, will substitutes be trained? And the answer to that question is an emphatic yes. We will make sure that we have the training available for all of our substitutes. And as some of you may have tuned in at our recent board meeting, we have a new LMS system called Canvas, and we will ensure that substitutes are trained on that as well. Training is being provided for our teachers, and while that's happening, we will also shortly after that provide that training for substitutes so that we can make sure that our substitutes are able to step in if needed. Thank you.
Thank you, Mr. Zaid. We're on to Dr. Simon.
All right, hello to everyone out there. I'm not sure how many people have tuned in, but thank you to those who have tuned in today just to listen to what the district is doing in certain areas. So first I want to say the health and safety of our student, staff, and families is of the utmost importance, right? We've taken a lot of time to review the guidance that we've received from several public health officials, our California School Nurses Association organization, So the health screening guidelines I'm going to read today are really based on a myriad of support and guidance that we are receiving at this time. And as Dr. Brown mentioned, knowing that that guidance is sometimes fluid, it changes. So we're always re-looking at guidance as it comes in. So in regards to just health screening, it's just great to note that students and staff will be required to perform a self-health COVID-19 screening before entering campus, and we're going to send out the questions that we would like our folks to ask themselves before they come to campus, and they're screening questions that are standard and that are highlighted by our public health officials. If folks are able to conduct a temperature check before they come to school, right, we'll be asking for that as well. We are, and when I say we, our Human Resources Office, the Office of School Support Services, and other staff members are reviewing several apps that can be downloaded onto mobile devices to conduct screening questions prior to coming into or coming onto a campus or to a district office. Some of these apps can also take your temperature, or you can actually plug in your temperature actually into that mobile app, so that when you come onto the site and you show the screener the app may say green, right, or show green, excuse me, meaning that this person is good to go, they've answered the questions, they've conducted their temperature check, or red. And red means that that person probably should not be on campus, or will give the screener another opportunity to ask those questions and also to conduct a temperature check as well, which would be a contactless temperature check. I want to note that. For students, our wonderful students who are taking bus transportation, which at this time are certain students with disabilities, and we would ask parents the same to conduct those pre-screening questions, conduct a thermometer or temperature check before those students get onto the bus, and when those students get off the bus, right, the screeners who would be at entry points throughout the school would conduct another health screening for students who are receiving bus transportation. If a student or staff has any unexplained signs or symptoms of COVID-19, we would ask them, right, to respectfully stay home. It's the same thing that we currently ask within our district building. Please do not come. So if you have a fever, which is our standard protocol already, please do not report to work. Please call your site to report your absence. And with COVID-19, right, the protocol will still be the same. COVID-like symptoms, and we talked about this, what they will look like: cough, fever, chills, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea. And we have some people who say, well, look, I have hay fever, I have sinuses, I have allergies. I know I have allergies, and sometimes I'm sneezing or whatnot, and we're going to work through even more to help our staff with that. But most of that is going to be around really more the screening questions, and also ensuring that we also have the temperature check embedded as well. We're also stating that if students or staff have been in close contact that is less than 6 feet for more than 15 minutes with someone that is COVID-19 positive, they must stay home and contact the school or site to report their absence. Students or staff who fall within this category will receive a follow-up call from a staff member at the site. And that may mean having follow-up questions, discussing. A staff member may say, like, I went to the doctor, I'm waiting on something. So there's going to be a clear line of communication as far as follow-up for students and staff that fall within this category. Dr. Brown talked about the screening supplies and what that's going to look like, and not to reiterate too much of what she said, but just know that each staff member who is conducting those screenings will have a touchless thermometer, hand sanitizer, PPE, such as disposable masks, face shield, and gloves. Such items will be used. We'll also be asking our screeners to wash their hands prior to screening, and also after they've finished conducting screening. We talked about the contactless temperature check. We talked about the temperature of 100.4 or greater. We want those folks to stay home. If someone comes to the campus, especially a visitor who has a 100.4 fever, they're not going to be allowed in the building. If a student is there and they have a temperature check, the school will follow their current protocol, which may be going to the nurse's office, contacting the family to pick up that student immediately. And that's something we wanted to impress upon our families as well. I know having backup plans in case someone gets sick, in case someone comes to the school site with a fever, right, we want that student to be sent home immediately and safely as well. As far as isolation rooms, just to speak about that just quickly, each site will have an isolation room, each school site, with a designated trained staff who's in that room. Such staff will wear a gown, a medical grade mask, face shield or goggles, and also have disposable gloves. And if a student is found to have COVID-19 symptoms, while entering campus or during the school day, the student will be sent to this isolation room. So we're still going to have our nurse's office for some of the regular routine issues that come up with our students, but the isolation room will be specific for are specifically for students who fall within this category. And, you know, that's it, but I do want to just reiterate, the guidance, the protocols will change. They're fluid, and that's based on just guidance, our new guidance that we receive all the time from our public health officials. Thank you for your time.
Thank you all for the information that you've provided based on questions we've been asked. So this is a time when Ms. Ritson and I have brought together the questions that have been asked on our social media account. We're going to ask you to address some of our staff's questions. Before we do that, I do want to assure staff that in the next few days, we plan to have a handbook out that compiles all of the information that you've heard our staff talk about today in one place. It will be for the use of staff as well as for the use of families as a resource guide and for you to see all the pieces of the plan in one place. It's been in the works for a while, and we hold ourselves to a high standard of putting out a professional publication that we will have to you in a few days. I also want to let you know, those of you who aren't principals and work at school sites, that next week you heard mentioned that principals will be going through a training process. After they're through that training process, you know you can rely on your principals to help with questions and answers, primarily for staff and for families, and that we're a resource to them and to you in the days ahead. So today's the beginning of informational sessions. It's not a one-time informational session today. So we'll begin the questions. We have about half an hour and too many questions to ask in that half an hour, but we selected questions that were frequently asked by those submitted. So the first question I'm going to ask Dr. Brown, it's a statement and a question. Is any attention being paid to the fact that many top pediatricians around the nation are declaring that students need to get back to school, or the fact that in adolescence, many more deaths are being seen due to suicide and drug overdoses because of the isolation being imposed?
So we are paying close attention to all the guidance, and I will say that we would like nothing more ourselves than to bring students back to school. We believe it is the best and safest place for them to be, the place where their both academic and social emotional needs can be very well taken care of, where they can engage in extracurricular activities, social interactions, and all the things that we know make school very healthy. With that said, we are first and foremost recognizing the health and safety crisis that we've been in, and we are working with the guidance that we have, both the order that we have from our governor, the guidance that we have from our state health department, our county health department, and our local Long Beach health department, all of which tells us it is not safe to return to school now. With that said, we are preparing to socially and emotionally outreach to students. We're preparing for ways that we will have counseling resources available, as we did in spring and throughout summer, but even in a more developed way, because with each experience, we learn about how we can access and get to students in a way that is more supportive, in a way that could be more supportive of their families. And so we are paying close attention to that information, looking forward to the moment when we can return everyone to our campus, but really proceeding cautiously around the health and safety guidance that we have right now that says it's not the right time to do that.
A little bit of a follow-up question to that for either you or Dr. Simon. The follow-up question is, how is the district planning on addressing the mental, emotional, and social components of health for students and staff? So I know, Dr. Simon, you're doing some work right now that you might want to let the staff know.
So as far as social emotional learning, and I want to make sure that social emotional learning and mental health are differentiated because they're not the same. So with our social emotional learning, there are some things that are definitely being embedded into the actual instructional day, which would include some mind movement, breathing techniques, and such, which will allow students to take such breaks during the instructional time. And many more things are under works and are happening as far as training for our teachers, and just deeper conversations around what should SEL look like, especially during the online instructional time. For our mental health needs, we do have the family resource centers right now that are working with 26 sites. As we did in summer, we're looking at ways that we can also expand or expound and do some things within the other schools to address more of the mental health. But still keep in mind that our staff is constantly working with all stakeholders within the school sites to train and to discuss mental health and anxiety and depression and things of that nature. And we still have great support from our school-based mental health providers, just to name a few, the Guidance Center for the Child, who are working with us when our students reach this higher level of need, a more intense need, and need more direct services that are intensive to address their mental health concerns. So we do have a pretty robust system just in regards to how we're working with our families, also in regards to our check-ins. That's from a SEL standpoint and also from a mental health standpoint. This year, we're going to start with telecounseling just so that we can continue with the services, just because we know that we cannot meet students face-to-face at this time. We did have a pilot run, if you will, during the summer, and it worked out exceptionally well, right, for many of our families. So something that we want to continue. And for our families who don't feel comfortable just with the virtual setting from telecounseling, phone options will be available to where we can still check in with families and provide services and sessions for our families from that standpoint. I can just say I'm just very grateful for our community and many of our agencies within this community for being a supportive factor for many of our families, for helping us, even as far as training, even as far as connection, whether it's mental health, SEL, our food pantries, housing, Medi-Cal. I can go on, but many of these things are kind of one and the same because one thing triggers something else. So if we're able to help a family, right, who is worried about being evicted or worried about food insecurities, right, that can help many other things that are happening within that family as well. So I'm always excited to address some of that. I know we don't have enough time for me to go through the whole continuum, but these are some things that we are doing to help our families in this way.
Thank you so much to our audience, our community members at home. They're watching. I know this was put together. You know, the questions just went out a few hours ago, a call. But, you know, as things are moving so quickly, we're looking for more and more ways just to communicate to the community as things move and as we're planning. And so I'm going to switch gears, and this is probably for Mr. De La Mora, a little expanding on some sanitation pieces. So there's some misconceptions about there that we've talked a lot about the school sites in the last few days, some of the videos and pieces that I've put out. People are asking about the non-school sites, administration building, the offices. Are they being cleaned at the same level? What's the frequency? What about common areas and workspaces in some of our offices?
That is correct. Those areas are also being addressed on a daily basis. Again, we're currently working and ensuring that all of our school district facilities have access to electrostatic sprayers. I'm not 100% sure if they have all been delivered. I know majority, if not all, of our school sites have been covered, but I would need to follow up with the warehouse to ensure that these were also delivered. But yes, at the end of the day, we will be addressing all surfaces the same way through electrostatic means. Currently, if the school or the school site or the facilities don't have access to electrostatic sprayers, they do have access to disinfectants that are in spray bottles, and they're disinfecting those surfaces that way using spray bottles and microfiber towels at the current moment.
So let's go back to the school sites now. So a little bit. So there's some teacher questions. This came up quite a bit. You know, like I said, we've had so many questions that we're trying to narrow this down in such a short amount of time. How many times a day will custodians on campus be cleaning teacher-used restrooms? So some of the teachers, that's a big concern about. I'm in my room, I feel comfortable, but I need to use the restroom a few times a day. What's that process and that protocol that's in place?
Again, it's going to be done 3 times a day in disinfecting towards the end of the day. One question that I saw that came up was, how are we going to track that the cleaning is actually taking place? We all know that we're a Williams school, and when we became a Williams school, we developed a form where the individual that's addressing those restrooms goes off and checks off, initials, time, and date stamp the time that the service was provided to the restroom. We plan on continuing to implement this form to ensure that these spaces are sanitized 3 times a day, disinfected at the end of or prior to the end of the shift, the custodial shift. So just to give you an idea, maybe 9 o'clock, 12 noon, 3 o'clock, something in that fashion. Disinfect or sanitizing of those spaces, and then disinfecting. The thorough cleaning will happen at the end of the day before the custodian goes home.
Thank you. Can you remind us of how that information is recorded and how it's tracked for accountability that those were done, those cleanings were done?
Yes, correct. We have a current form that every plant supervisor has that they duplicate and they place in the closet where the restrooms are. Actually, there's a closet in student restrooms, or there is a log, a clipboard that the plant supervisor keeps in his office, and they log down whether it's the plant supervisor himself that's addressing these areas or the custodian assigned to that on that assignment is the one that initials, timestamps, and dates the time of cleaning.
And it's been of interest to staff and to the public. Can you share a little bit about the area custodial managers and how they support disinfecting and sanitization at our school sites?
Yes, we have 2 area custodial managers, one assigned to the elementary sites and one assigned to the secondary sites, and we also have 2 custodial services inspectors, again, one assigned to assist elementaries and one assigned to assist secondary sites. The operations management team provides assistance in training and guidance for our custodial crews. They're currently out training this week, making sure that the training is taking place for the proper use of the electrostatic sprayers. Principals, plant supervisors to reach out to our department for additional assistance, whether it's in new procedures, implementing new ideas or new protocols, and we're there to assist. So if any of the school sites, plant supervisors or principals need additional assistance, all they have to do is reach out and we'll be there the next day.
Mr. Zaid, you talked a lot about the signs that have been developed, the signage. Can you just talk about how staff will access those signs, either what's being provided or how they'll access those signs for their buildings or offices?
Sure. So not only will we have the information available in the upcoming booklet, but we also have the signage that can be ordered through duplicating. And so we have a duplicating system where every COVID sign is available. We start with printing them and sending them out to all of our school sites, and then if any of our sites, buildings, or departments need extra or have an area that maybe we didn't account for, our duplicating website allows you to log in to order additional signs, and they are immediately delivered to you. So it's one of the ways that we make sure, again, that we not only have our protocols, but we also have the reminder signage in the form of posters to make sure that everyone is staying compliant with those health and safety measures.
Questions. This is more than likely for Dr. Simon, based on some of the videos that we released this week of you sharing health checks and talking about that safety piece. A question that came up a few times was, will all people entering the school buildings be temperature checked every day? And then just to clarify, LBUSD will not administer any COVID testing to anyone.
So that is correct. So anyone who enters the campus, whether you're principal, assistant principal, teacher, counselor, whomever, student would have to go through a health screening, which would also include a temperature check. And what was your other question, Chris? I'm sorry.
Will LBUSD administer any COVID testing?
No, so there will be no COVID testing that will be administered, well, at least at this time, but nothing that, no. So just to say no, I don't want to add any qualifiers. No COVID testing for LBUSD.
I don't mean to keep putting you on the spot, but there's another question because it was kind of in order. So this came up, as people are scared, people are nervous about, being in contact. I mean, I know for myself, I go into the grocery store, and if I see somebody's mask incorrectly, it freaks me out a little bit. What if during a health check, an individual gets a high temp reading, but they demand to come in the building? What is our protocol? How do we approach that?
I think just with grace and being sensible, just by politely asking that person just not to come on. I don't know any other way to address it, but just by simply saying that person would just be asked respectfully not to enter the campus. And so with our campuses now, I guess one of the good things as far as the safety measure, parents do have to buzz in, or visitors have to buzz in if they're coming in right after school hours. So that is also going to be a way to help hopefully eliminate or mitigate some of those issues. But it's just really for us working with folks and respectfully asking, right, not to come on campus.
So if you don't mind, I'll just jump in
Absolutely.
on that and just also say our approach is always to be professional and respectful, but we will not allow them to come on campus if they're insisting. And let me just speak not only to individuals who may want to come on campus, but what happens if we have an individual who doesn't have a temperature but comes on campus and begins to feel ill? What steps do we take? And again, a part of our system checks require all employees, if they are feeling ill, we want them to go home, and we want them to take care of the necessary precaution. If any employee is experiencing any symptoms, we want to remind them that they should be at home at least 72 hours without any symptom-reducing medicine. So these are a variety of ways that we just make sure that, you know, our employees are complying with the expectations and the guidelines.
So Dr. Brown, there were a number of questions about the opening of schools. Some of them said, you know, what is it with the October 5th date, and staff is asking about the safety of opening. So two questions are, who will make the ultimate decision regarding being able to open school in person? And then what requirements have to be in place in the district once we are given the clearance to open?
So as we've stated on other matters, we will work from the governor's guidance in tandem with the California Department of Public Health, the County Department of Public Health, and our Long Beach Health partners. I think many are familiar of the idea of a watch list, which currently our county remains on. And the requirement is that we would need to be off that watch list for 14 days before schools would be considered as a part of the reopening mechanism within the county. We are not at that point. In fact, we are far from that point. And so we will be working closely and paying attention to all of the current information in order to determine when we are able to consider opening. All of the safety protocols and practices that we are describing right now are and will be in place for the moment that we reopen. And one of the things that's been kind of confusing or hard to talk about is that we're talking oftentimes from two perspectives. What we're doing right now as we reopen our schools virtually and with staff returning, and what we will do when we have students returning. And so all of the procedures that we have described and all of the protocols that we're putting in place are being made for the day that we need to, that we get to, not need to, that we get to return students to campus. And we're looking at the things that we're putting in place right now as practice for that moment when we have more people on our campuses, and we'll need to take all of the safety precautions that are in place as we're guided by the agencies that I've mentioned. And the October 5th date, because you mentioned that, was a date that we determined in collaboration with our health department. That was a date that brought us about a month out from the opening of school, and we have looked at that date as a check-in point to see where we are. Our hope is always that we would be able to reopen, but again, with the parameters that I've just described in place, we will be considering as we approach that date what we are safely able to do and what we're guided to do.
Going back to the PPE, Dr. Brown, you know, there's a lot of questions about face shields and masks of what will actually be distributed to staff members. Okay. And the second piece of that is, what about plastic barriers? Is our district investing in that? Are we using that those pieces of PPE.
You
as
said
well.
plastic carriers?
Barriers, sorry.
Oh,
Yes,
barriers,
yes.
okay.
So really talking about what is the protocol for what's provided when it comes to face shields and masks
Sure.
for different staff members, and then also the plexiglass shields as well.
Yeah, so as the video shared earlier this week, we've made quite an investment in facial coverings and face shields, as well as medical grade masks for those who would need them. We are making all of those items available for staff and for students when the moment comes. If they need facial covering or if they need a facial shield. We purchased the facial shields particularly for a couple of different groups. One, for teachers who teach either a group of children who are young or who have the need to have a full facial view in order to better understand or communicate. And so those we've purchased plenty of them to be available for staff, as well as a person like a speech language pathologist who really needs full facial view in order to communicate with their students. We've also purchased facial shields for students who have either communication challenges or just a challenge wearing a mask. As I think we all know, it's very uncomfortable to wear a mask. Some days it feels more uncomfortable than others, and so we've purchased facial shields to be available for students. Sometimes the misconception is that a facial shield is enough, and a facial shield is fine as long as you're not in that close contact. When you're in close contact, the expectation is that a facial covering is also worn. You also asked me about plastic barriers, and at this time we are not going to be using any plexiglass in our offices. That's not something that we are pursuing. What we are encouraging, recommending is that we use all the social distancing practices, and so what we are doing is in the moment when our office traffic would be more like it would normally be, we have distanced spaces set up within our offices. We have the personal protective equipment. We're encouraging all the good hygiene practices, but at this time we will not be using plexiglass as a manner of separation.
The next question is for Dr. Simon, and it pertains to special education classrooms. A staff member who is concerned about distancing in special ed classrooms. We have many students that cannot be distanced for a variety of reasons. They note behaviorally and academics. Will special education classrooms have their ratios reduced as general education classes have? And what accommodations are being discussed to help us with this issue?
So I'll just say first, the class sizes for some of our students with disabilities who are in the most restrictive classes, the ratio is already fairly low. So I would think we would have to look at, number one, how many students and how many adults. We have sometimes adults in the classrooms who are helping with behaviors. There's also instructional aides who may be in that classroom. So I think we'll have to look at those numbers to see how we can accommodate those classrooms to ensure that they are at the appropriate number to serve students and also to keep our staff members safe. So it's going to be looking at several things. Number one, how many students and staff members are in that classroom, right? The class size, the accommodations, and making that decision just based on that.
Can I add something? A question that I've been frequently asked is from parents or staff who work with students with more significant disabilities, and the question is around what would we do if a student is not able to tolerate a mask? And I answered that question for a student who is completely cognitively intact, but I just wanted to mention that I understand that that is a community concern for our families and our staff who support our students who have more significant disabilities. And I think that we need to look at it on a case-by-case basis. One of the things that the state guidelines have done is they have lessened the requirement for mask use for students second grade and below. And something that's important about that in relation to our students with disabilities is that we do need to consider the developmental level of the person and if they would be able to tolerate a mask. A student may developmentally be at a much younger age than their chronological age. And so we need to treat those students as if they were younger in terms of their ability to tolerate a mask. We also need to consider any medical challenges that may be there. And so if you're a teacher who's watching and you know that you teach a class for students with moderate, severe disabilities, and you're thinking, okay, so if I have a student in my class who I know won't wear a mask, and I know that you would know exactly the student that I'm thinking about or the students that I'm thinking about, what would that mean for you? One of the things that we have planned for, recognizing that we will have groups of students who are not able to safely tolerate a mask, is we've purchased a higher grade of protective equipment for staff who work in those rooms. So it may be that staff who work in those rooms are wearing a medical grade mask. They are wearing a facial shield also. They are wearing a gown also to be more protective, or they're using gloves regularly. We're not expecting that of a teacher in a typical classroom, but I think it's important to acknowledge this group of students and this group of staff who support them, as well as their parents who are thinking to themselves, no matter what I do, I know my child will not be able to wear a mask. We know that too, and we are planning for that. So it's going to become, as the time draws near, an individual conversation about the needs of that specific group of students.
So we had multiple questions about school nurses that came up, and so I don't know who would want to field that question. Maybe Dr. Simon, you may want to talk about this because it has to do with health checks. How are school nurses currently being consulted in the planning stage for reopening? And then the second question is, who will conduct health screenings at sites that do not have full-time nursing staff?
So that's still a conversation that we're engaging in about just the health screening. I'll answer the second part first, and I'll ask Dr. Brown to help me tag team on just, the nurses. So we're having conversations with our administrators and, other stakeholders to discuss who could, potentially be those screeners. But I think it's fair to say that we haven't identified like a group of who would potentially be those screeners, but just knowing that screening would have to take place within those sites. I think that's fair to say.
I think it's important to note that it doesn't need to be a nurse who does a health screening. So staff can be trained to conduct a health screening. It doesn't need to be a nurse to take a temperature. And so we need to be very upfront about that we will be asking staff members who are not medical providers to participate in the health screening process. And as principals are back and we've trained them on the protocols that we're asking, we will be asking them to identify staff at their site who will be conducting the health screenings. In relation to the first question, we have had several different work groups that are developing the protocols around our school operations and practices. We have had our head of nursing services or student health services as a part of that group, and something that she has done is she has been regularly meeting with a group of nurses for input on all of these areas. So all of the recommendations that we're making, aside from being guided and directed through the agencies that I routinely mention, I think it's also important to note that our own nurses, a group of selected nurses, have been participating in the design of these practices to determine that they are functional for a school setting. So we're very grateful to those staff, nurses, and others who have participated in the development of the practices that we are training on right now.
Been collaborating with their state nurses organization as far as helping out with that guidance as well, and bringing back such guidance to staff to discuss. And as you can see from our health screening protocol, right, it was based on guidance from several different public agencies and also, right, the state's Nurses Association. So I want to give a plug to that as well. And that speaks to the work that Dr. Brown mentioned, the work groups that she mentioned. We had some of our nurses here yesterday helping us conduct screening checks for our folks who are coming in for public comments. So they're very much involved in the process and also our protocols for the district.
And we're watching you doing that in your video that we put together. You listed all of those different major groups from state and local agencies to the Nursing Association.
Absolutely.
We're not at a loss for guidance. We have a lot of guidance. The challenge that's always in front of us is determining how we are going to implement the guidance that we have.
And that's what I don't use. Sometimes that miscommunication to the public that you're just making these decisions in a box somewhere and not understanding that how much you're networked with all of the major agencies that we need to make these proper decisions to keep our staff safe. Can I go one more question? Sure. Awesome. So just students, going back to students, being a former teacher, of course, that's always something that's all on our minds, and even for the safety of our staff, it matters. And so a question that came up a few times was, and we may not be able to answer this, of course, yet. We're not close to this yet, but will there be training for students on how to properly use PPE, how to wear masks, and how to properly socially distance? I know there's a lot of misconceptions, even in the media, of when to wear a mask, why to wear a mask, how it all works, the science of it. We talk to the health department quite a bit and get a lot of that information, but sometimes people are unclear. When you're talking about our young people, where are we looking towards that as we move towards the future?
Absolutely. And one of the things that our teachers and our school staff know how to do very well is how to teach protocol. How to teach, and we see it all the time in the way that we guide school, right? How we line up, where we stand, how we stand, when we stand. We do all those things with the idea that having a good environmental protocol helps the way people feel in that environment. And so absolutely, yes. And we've already seen through our child development centers and Head Starts that our very youngest children are very responsive to expectations. That when taught to wear a mask, when taught to stay separate of one another, when taught how to line up differently, when taught about the more regularity around hand washing, having shoes sprayed, etc., even our very youngest students are very responsive to being taught how to do something different in the environment. And I think that it's in the spirit of self-advocacy for even our very youngest students to teach practices around hand washing, around wiping an area as you come into a space. It's really about teaching from the youngest level how to be cautious and be responsible for our health, which is actually a part of being resilient, which is a part of taking good care of ourselves, which is a part of advocating for ourselves and really knowing how to feel comfortable in the space that you're in. So absolutely yes, and I believe that we will be able to successfully do that even from our very youngest students.
A quick plug is, we have a media piece coming out tomorrow that's actually showcasing the CDC, and you actually get to see students that are wearing face coverings and following all of the protocols. And as a parent of a 4-year-old, it was reassuring for me to be standing there and watching kids being kids, but following all of these guidelines. And so, into that question, that's going to be exciting to see all of our age groups come together and our families teaching that as well with our community.
I discussed in regards to SEL. So I just want to also express to our staff out there, whether you're a counselor, a school psychologist, a SOP, an administrator, a teacher, that there's also SEL for you as well. So we are building a curriculum, if you will, that will provide social emotional learning for our staff members. This summer and during school closure, we did some things as far as building a Google Classroom with the help of our family resource centers staff, our foster youth social worker, our all-in crew, our homeless youth staff. And we also worked with Parent University to build SEL and videos and even around mental health, right, even though they're two different things for our parents and our guardians. So I just want you to know that that is going to continue. That work is going to be elevated because we do realize that, right, you need that support, you need the SEL as well.
As we're wrapping up, just a resounding thank you for taking your time with us this afternoon. I can imagine that if at 3 o'clock on a Thursday afternoon you're choosing to watch this video, it's because you care a lot, or you're concerned, or both. And so this is really an effort for us to convey more information to you and to, again, share some of the ways that we are planning as we welcome our staff back and look forward to the moment when we can welcome our students back and more of our community back. So thank you very much for the time that you've spent with us today.
I'll just also share just some final thoughts from a human resource perspective where we don't just focus on the resources, we also focus on the human aspects. And I'll just share that as we learn more, we see opportunities to continue to grow and develop. I think of some phrasing that has developed, how we started off with social distancing, and then we realized that we could still stay connected, and it wasn't really about social distancing as much as it was about physical distancing. We saw that shift in terminology. The same thing with school closure. We were using the term school closure, and we saw it shift to redirected learning, because the learning wasn't actually closing or stopping, it was just being redirected. There is one terminology that we were using in March and April, and I'm just not hearing it as much as we used to. And that was the terminology that we would see on commercials that would say, when it comes to this pandemic, we are in it together. And so I just want to conclude by sharing with all of our teachers, our staff, our classified staff, our parents, anyone who is watching this with an invested interest in the success of our students, that one thing that has not changed is we are in this together. I just want to thank you for joining us and be a part of this tremendous work. Thank you again.
I want to take a moment to thank my co-moderator, Mr. Itzen, and our panelists, Mr. De La Mora, Dr. Brown, Mr. Zaid, and Dr. Simon. Thank you for coming to be with our community today, our staff who are both worrying and thinking about all the questions they have. We didn't get to all of the questions, but you answered many of them. So again, to our staff and people who are watching, this is the first of a series of informational sessions. We'll publish the calendar for the weeks ahead so that you have more time if you want to. Thank you for those of you who submitted questions and are helping us to get good information to you. We'll see you soon.